the result of the collective response between the Ministry of Health and the Ministry of Local Government. I want to make the point again and to emphasize that since the 14th of May, we start testing residents and workers in all infirmaries. We were able to conclude those tests in reasonable time. And since then, we have done 7 more infirmaries, again, going over testing as the process increased. So it is because of this approach, we were able to discover the cases. And as I said before, our commitment is to work with the Ministry of Health to bring the spread under control. I want to use the forum, as I did yesterday, to invite members of staff who has not yet reported to the institution to do so that they can be tested. I'm encouraging all members of staff to do so. And we are now putting on high alert all of the infirmaries across the country. And we have already issued strict instructions as to the guidelines that was in force before, and we are now going to be reinforcing and strengthening those guidelines, working closely with the Ministry of Health. So those are my opening comments.
Thank you very much, Minister Mackenzie. Thank you for the presentation, and you have echoed our giant collective approach, which I think is good for the COVID response. And I want to just say to the public that your ministry has been extremely cooperative and working with the Ministry of Health towards managing this pandemic that the country has had to face since the start of the year. We have, on record, just before questions, we have some 214 nursing homes and 15 infirmaries. 206 of the 214 nursing homes have been inspected. 206 are operational. So even though we have 214 on record, 206 operational. This is according to the public health team who works with the standard agency, and they go out in the field and do the inspections. And you would have heard me commented some time back that those inspections were a priority once we concluded that those residents were part of the vulnerable communities that needed particular attention around adherence to the COVID protocols. Of the 206 that have been inspected, 95 met the requirements around the protocols immediately. 116 were found to be unsatisfactory for one reason or another. And the team has been working with those to bring them up to speed. In terms of infirmaries, 7 initially met the criteria. 8 were considered to need more work. And again, the public health team working with our standard agency has been working with these institutions to bring them up to speed. We always knew that institutions like infirmaries, nursing homes, the prisons would represent particular challenges because of the nature of those institutions, the fact that it's a confined space, because of the persons who are residents in those institutions, persons who have a particular age, comorbidities, and so our protocols have been in effect for some time, and to date we have had 1 or 2 minor, cases, situations. This represents the largest, but this entity, the Golden Age Home, is the largest of its kind, I think, in the Caribbean. I visited maybe 3 weeks ago or so, and to observe what was there. And I do believe that the entity, the management, supported, of course, by the Ministry of Local Government and the KSA, I was there with the mayor, have made good attempts to ensure that a protocol
No, yes. It's not us.
The point of wearing a mask is to prevent the spread of air droplets from persons who may or may not be infected. When wearing a mask, please ensure that the mask goes above the nose and below the chin. This might be a bit uncomfortable, but it's for your own safety. The position of the mask is very important. It should not be worn on your forehead, under your chin, or on your neck. Please do not remove the mask when speaking. This actually causes more droplets to be released into the atmosphere. Trust me, if you have on a mask, we will still hear you. When you're removing a mask, try not to touch the front of the mask. If you do, remember to wash your hands or use hand sanitizer. Please throw away the mask appropriately. Remember, partial protection is better than no protection.
Before the hurricane, create a supplies kit. This should include water, 1 gallon of water per person per day for at least 3 days for drinking and sanitation. Food, at least 3 days supply of food, non-perishable of course. Battery-powered or hand-cranked radio and extra batteries for other flashlights. A first aid kit. A whistle to signal for help, dusk mask to help filter contaminated air, and duct tape because it works on wet surfaces, wench or pliers to turn off utilities, and a manual can opener for food. Local maps and a cell phone with chargers, inverter or solar charger. Finally, ensure that you have adequate medicinal supplies for family members with specific health issues. Remember, always be prepared.
Good morning. Are you hearing me? Afternoon, sorry. Are you hearing me?
Yes, we're hearing you. Go ahead.
All right. Minister Mackenzie said that the staff at the Golden Age home, those who have not reported, are being invited to make contact. My question is, isn't this a case where these staff members the ministry should be making contact with them, or is there a difficulty there?
No, let me just clarify that.
Oh, go ahead.
Let me just clarify that.
Yeah, Minister.
There is no difficulty. There are persons who are on leave, and there are persons who are not aware. So I made a general appeal last night, and I said I'll make it again for those persons who have not yet been contacted. And based on the information that almost 80 to 90% of the staff has reported. So there is no difficulty so far that we are aware. So just want to clarify that.
Okay, and we are working with the ministry, Mr. Mackenzie's team, to ensure that all the members are notified and tested and are appropriately guided in terms of the the steps that they need to take during this interim period. So it's not an issue. It is being done. Okay, next question.
Thank you, ministers. I'm going to go to Damian Mitchell.
Yes, thank you so very much. A few questions. Let me take this one first. The inspections to which you refer, Mr. Tufton, Dr. Tufton, can you say generally when these inspections were carried out? And specifically in relation to the Golden Age home, when was that inspection carried out? I have a couple other questions, but let me have that one first.
Okay, so the inspections have been ongoing. When the COVID response was first being rolled out, this is all the way back in January, or certainly early February, having gotten cabinet's approval late January. Among the groups that were targeted were what we classified in their approach going forward as the vulnerable communities. And the institutions, like the Golden Age Home, were among those key groups, both in the private and public sector. We had an issue, to be totally frank, in that a number of these institutions were not officially certified, which is a requirement of their operation by the agency within the ministry, the standards agency. And what I had asked to be done was whether or not they were officially certified, every single one of them in operation should be inspected and the infection control and prevention measures given priority for implementation. So we use the public health inspectors, public health officers who went out and did the inspections. They're all in the parishes, over 150 or so of them. And they came back with those initial reports, and instructions was to work with these entities to bring them up to speed. It is an ongoing process. Even as we speak now, inspections are taking place. It's a matter of doing an initial inspection, assessing where you are, giving instructions, then going back. Now, as it relates to the Golden Age home in particular, do you have any information on when exactly that was? Dr. Strawn is online? All right, I'll check on that and try to get back to you on that before the end of the question and answer here, Damian.
All right, Minister. The timing is particularly important for me, and I'll make reference to what you said was a visit you made to the institution 3 weeks ago. Can you say, based on your observations then, what has been done at the Golden Age home then, between then and now, having identified what Minister Mackenzie regards as slippages?
Okay, so firstly, there are, Minister Mackenzie will determine and can comment, I'm sure, on what his interpretation of slippage represents. But when I went, I was keen to look at the structures that were in place. So starting at the gate where the temperature check and the hand wash stations were in place, which meant that persons were expected to go through that process. Workers coming in had changing arrangements, an area where they had to change so that they would not bring any possible contamination on their clothing that they had on the road to go isolation or the separation of blocks so that persons weren't commingling. And as was said earlier, the outbreak has taken place in one particular segment of the population, which is a good thing because what it means is that you isolate that area, and that was in place. The wearing of masks was observed, not for everyone, but certainly for a number of persons, particularly the workers, the staff who were dealing with the residents. An isolation room I inspected, and that was fairly new when I went there. And that I think there were maybe 2 rooms that were considered that were zoned as isolation rooms, and the sanitization stations were in place. So, to my mind, there was a fairly good setup in terms of the infrastructure. Now, bear in mind that that is an important requirement, but not the only requirement to reduce or even eliminate the possibility of the virus coming in. A lot now depends on how the infrastructure is used. And therefore, I am not there every day, neither is Minister Mackenzie, to determine whether a worker who is supposed to change breaches that periodically. I don't know. I'm not saying that is the case. Or whether the sanitization should be an automatic thing happens, or the wearing of masks. The truth is that a lot now depends on the management of the institution to ensure that the infrastructure is utilized and the protocol in terms of the behavior, both for residents and for employees, is adhered to in the strictest form. And Minister Mackenzie maybe can comment on that to see if he thinks that there may be some breaches there or easing of those restrictions, which may have led to this. What I'll say before he comes in is that even when you adhere to all the protocols, there's always still the possibility, that's just the absolute reality, that the virus can take hold, because it only takes an improper wearing of the masks and then touching it with your hand and then touching a surface for the virus to take hold. So it's still a very difficult call, but we did have a fair bit of the protocols in place. I'm told, by the way, Damien, the last inspection was done on September 28th. This is from the KSA Health Department, Dr. Myers. The last inspection was done on the 28th. But Minister Mackenzie, you want to just come in there and add to what I've said, sir?
And yes, probably say who will be...
Hold on, Damien. Let Minister Mackenzie just finish add to what you had asked.
Damien, the first set of inspections started somewhere around in May, where all the infirmaries, and as the minister just updated you, that an additional test was done. So what we have tried to do since the measures is to have more than one testing of residents in the infirmary. And we have been very successful in doing that. The fact is that we can't deny that there has to be some breach why the virus has infected so many persons. And based on the testing that has been done and the tracing and the limited information that we know, it is clear that it is out of those breaches that the residents were infected. And as I said earlier on, the investigations to determine how and who is on the way. And, you know, based on what is required, even if we know, we can't say, because we have to protect the individuals that are involved.
Okay, next question.
I still am not very comfortable or satisfied, because I'm making specific reference to what you've said, Doc, that you visited the institution 3 weeks ago. Mr. Mackenzie says that he has identified slippages. I really want to know what has been done between then and now, having identified that all the measures were not being adhered to in respect of the protocols laid out by the health.
Well, let me just say that I never said.
Let me just respond to that. We meet on a regular basis with the heads of agencies to go over the protocols and to ensure that we do all that is necessary. We took in face shields into all the facilities to improve the capacity of the staffing. Now, it is going to be difficult to police every area of the infirmaries, you know, despite our best efforts in doing so. And if a member of staff or any individual coming into these facilities is not showing any signs of discomfort as it relates to the virus, but is in a position to transmit, then, you know, the temperature check and the sanitization and the wearing of the gowns, you know, all of that would not be able to prevent if we are not able to pick up. And it is clear that the individual who started the transmission would not have shown any signs. And the supervision, based on the discussions we were having last night with the management, everything was done to try to ensure that the weaknesses in the system, which I admit that there are weaknesses, not just in the infirmaries. So it is difficult, Damien, to respond to say, what are the measures? All the measures that were laid down when we gave the infirmaries a charge that we are not accepting no new patients, no visits, the protocols in terms of the sanitization, the temperature checks, all are in place, Damien. All are in place. So I don't know what more we can say to satisfy the questions that you have asked, Damien.
Very well. Minister, some of the questions are not specifically related to COVID, so I'm going to allow my colleagues to and then I'll come back with
questions. So I'm going to allow you only one more, please.
I'm saying my other question is not related to the golden age home. So I'll allow my colleagues and then I'll come back to ask a question related to COVID, not directly related to.
Thanks a lot. Next question.
Thank you very much, Minister. I'm going to go to Jamaica Social.
Are you hearing me?
Yes, go ahead, please.
Good afternoon now. Can you say from the figures that you've given us about how many people have been affected, can you say what the status is, or give me a breakdown or give us a breakdown of the status of these persons who is moderately or mildly ill or in critical condition or anything like that?
Okay, thank you. I'm told that except for the one 73-year-old, I think, who was the initial case that was identified at the health facility, the others are asymptomatic. So that's good. So what we have to do now is to watch them carefully, treat where we need to, and see how it unfolds. As I said in my statement, over the next 14 to 21 days. Next question, please.
Thank you. We're going to go to Emma Lewis.
Hi, good afternoon. Good afternoon. I may have missed this because I came in a tiny bit late, but what are the actual arrangements for quarantining these 43 people? I know that, the actual physical arrangements. I know that the Golden Age home itself has clusters because I've been there quite a few times. So I know it has like groups, clusters in terms of the layout. So, so where are these 43 people in quarantine, and what kinds of arrangements are made for them in terms of their care? Who is caring for them?
Okay, so it was addressed in my statement, which I will make public. I'll mount on this site,
sorry
on the
about
ministry's website.
Oh.
But you're right, the facility does have clusters. Those the outbreak has been identified in one cluster. We have, however, taken the decision to test all of the residents and staff. So that's going to be a fairly large task, over 400 residents and 162 staff members. We will treat the residents in that particular cluster. So that cluster becomes an isolation facility. And to the extent that they require additional care, meaning hospital care in particular, they will be relocated to an appropriate hospital, whether it's the University Hospital or the National Chest Hospital or any other. To the extent that they don't, we will make available our medical personnel to monitor and to provide appropriate levels of treatment at the facility itself. For the staff members, they have been asked, those that are positive for now, I think three are positive currently. They are isolating at home and will be monitored in the usual manner as we do other positive cases, with adjustments made as appropriately needed as it relates to hospital care.
Thank you, Minister. We're going to go to Romardo Lyons from the Star.
Good afternoon. Are you hearing me clearly?
Yes, go ahead, please.
All right. I have 4 questions. One is related directly to the Golden Age situation and 3 others regarding COVID in general. All right. So following the cases at the Golden Age home, will there be any additional measures that will be implemented at other nursing homes to prevent a similar situation?
Okay, continue.
All right. I want to check on the general COVID situation. So have we already reached a peak, or is it that the reduction in cases we're seeing now as a result of a reduction in testing? 2, what is the status of the other field hospitals? Are they still being constructed? And 3, recently, educators have called for a resumption of face-to-face classes. Has the ministry arrived at a decision in regards to that, or are we maintaining the same approach of virtual learning?
Okay, thank you very much. Tomorrow, in our usual way, usual approach, we will have our COVID conversations at 6 p.m., between 6 and 6:30, and we will address some of the more substantive issues around where we are as it relates to the number of cases, as it relates to the peak and so on. So I'm gonna invite you kindly to just exercise a little patience and visit us tomorrow, or listen in, and we will address that. Our epidemiologist will make her usual presentation to give a better appreciation of where we are. So I'm gonna not dwell too much on that. I want to just say, though, as it relates to the nursing homes and infirmaries, there is no doubt that we have adopted an approach to learn from every single experience. And this is, of course, the first major outbreak that we have had in the largest facility, not just in Jamaica, but perhaps in the Caribbean. And therefore, even with all the measures that are in place and have been in place, there has to be a review, and I've asked for that review to be done, working in conjunction, of course, with the Ministry of Local Government and Rural Development. And coming out of that review, any adjustments that are required would take place. One of the things that we have done in the past, which we may need to do a little more of, is random testing, to not allow so many persons to be infected before you have an indication that there is an outbreak in a facility. We do testing and we do random testing from time to time. Maybe we need to increase the intensity of that, particularly in the vulnerable institutions. And there are 1 or 2 other things that I think we may want to look at, having seen the operation of the facility firsthand, but I'll allow that review to take place based on the circumstances of this particular outbreak and then based on those measures. As it relates to other entities, the instruction that has been given to the standard agency and the public health officers is to increase the frequency of visits to these institutions and ensure that particularly those that have been found wanting, that we ensure that we push for all the appropriate standards to be put in place, because we would not want a recurrence of this in any other institution. So we're going to depend on our public health personnel to push for more oversight. And incidentally, we are going to be hiring more public health inspectors because oversight and management of the protocols will become a very important part of the future dispensation in the COVID response. And so inspections, whether nursing homes, infirmaries, supermarkets, or hotels, will become a very important part of the new norm. And the public health officers at the parish level are going to be very important to that process. The other questions around school resumption and so on. I'm going to ask that we discuss that tomorrow in our COVID conversation. There is a conversation taking place with the Ministry of Education, and the cabinet will deliberate around that conversation. And I think the Minister of Education in due course will, as she has been doing, update the public on what the latest position is. Next question.
Thank you very much, Minister. We're going to go to Twana Thomas from Nationwide. Twana, you there? Well, let's come back to her. We're going to go to Damien Mitchell for his final question.
Oh boy, see, I missed quite a few press conferences, so I think you have to cut me some slack. But Minister, I want to quickly ask you about the South Camp Juvenile Correctional Facility, where you had, I think, about 27 cases. What's the update there, and whether your review will be extended to seeing whether there were any breaches in respect of the protocol that you have laid out? And I also want to have some clarification. Is it that the Ministry of Health is now saying it will no longer be requiring 2 negative tests of a patient so that that patient can be deemed COVID-free?
Okay, so in response to the last question, yes, and that's not a new pronouncement. That was made some months, I think early August, I think. The updated approach to testing and treatment of positive cases has been to allow someone to serve in isolation for the 14 days and then be released. And that is guided by WHO PAHO guidelines that are frequently updated based on new knowledge around the virus and how to treat with the virus. As it relates to the South Camp Juvenile Facility, I need to find out exactly where we are there, but there is a standard process that's triggered with these situations. I mean, we first of all, having discovered a problem, we move in, we do the contact tracing, we isolate where that needs to be done. We do more testing of individuals to determine the extent of the problem, and then we treat with the patients and then review the process to see if there are any breaches and what needs to happen to enhance the process. And that is normally fairly standard as it relates to our institutions, because again, we have a vulnerable population that are in the prisons, the nursing homes, the infirmaries, indeed in densely populated communities where basic amenities are absent, running water, that sort of thing. Those are considered to be the vulnerable spaces. And then of course, on top of that, we layer the age cohort and the comorbidities as part of adding to the vulnerability and the risks. And the protocols around those is to give those added protection by prescribing a protocol, moving in to protect where necessary, and reviewing and adjusting where it is necessary to improve the process or mitigate against the risk. So for that, that is what we would do at the juvenile correctional facility in South Camp Road. But I don't know exactly what the status is now in terms of the numbers and if it has changed. I'd have to check on that.
Forgive me, Minister, but isn't there a risk with the new approach to do away with the 2 negative testing for the patient to be deemed to be COVID-free? And how are you taking account of those risks?
Well, you know, I like to say to persons who single out any particular measure as a sort of silver bullet to deal with COVID, that it is a very wrong premise on which to respond to COVID. The truth is that COVID has to be managed with a package or a menu of approaches, and each item adds to the resilience of the response. No single item guarantees that you will overcome the risks associated with the spread of the virus. In other words, there is no silver bullet in the response to COVID. That's very important that we all appreciate that. So the wearing of the masks, the sanitization, the physical distancing, the observance of the curfew, the quarantine orders for those who come in from the nationals, the tourism corridor, the pre-testing and uploading of information, and the tests and approach to testing generally has been assessed several times and is an important part of the response. In and of itself, it's not going to offer the solution. So the guidance that we get from WHO, PAHO, is that once we manage all the measures or adhere to all the measures, then there is no discernible greater risk because of the discontinuation of the 2 negative tests. And in fact, there are no rapid tests or more rapid tests that are now coming on stream. The antigen test, of course, is the one we announced on. That in a few weeks, 2-3 weeks time, when it is here, doing a test will be a lot easier, the results a lot quicker, and the offerings by the private sector will allow also any private individual to do test on demand. That will add significant capacity to managing the spread. So I'm not overly concerned, frankly speaking, by adjustment in one measure. What I would be concerned about is whether or not we adhere to all the measures that have been announced.
Thank you very much, Minister. There's a question as well too regarding the golden age home for quarantine, if it will be monitored by the regular staff members or if additional persons will be coming in.
Say that again.
For the golden age home, if additional staff, health personnel will be coming into the facility.
So the testing will determine a lot. The mass testing that we're going to be doing over the next couple of days, as was announced. You know, God forbid that we have more staff members testing positive, then clearly it would mean that the capacity for staff management, staff implementation would have to be adjusted. I'm sure Minister Mackenzie and his team, in their wisdom, are looking at that. We will have further discussions with them on it. You know, there are ways to do that. They can transfer from other facilities. They can hire temporary staff. They can move around people. I'm sure there's a solution. So, but the short answer to your question is, if there needs to be adjustments because of the findings of the tests, then those adjustments will be made.
All right. Thank you.
Just to respond to that, Chris, we have already started to put that in place. We have already identified some other facilities that we will be able to pull from, and the other methods that we are working along with the KSMAC in order to alleviate the problem. If as you rightly say, if the needs arises, we are in a position to respond to that.
All right, thank you very much, Minister. And those are all the questions that we have on the Zoom platform. I'll hand over to you for your closing remarks.
Okay, there's one final one from JNN. Go ahead.
To what extent is fatigue setting in and you think you might be losing that battle to keep people engaged?
Okay, well, I am, the question was to what extent is fatigue setting in? I'm assuming for healthcare workers or for the general populace? The general populace. I think there's definitely a sense of fatigue, and depending on how it is dealt with, one could argue even annoyance, frustration with some of the restrictions that have been implemented by the government through the Ministry of Health and Wellness. The same applies for subgroups within the population. The frontline healthcare workers are overly stressed, and there's definitely fatigue there. But I think the general population is engaging in a sense, you may want to call it withdrawal syndrome. You're used to a particular lifestyle, used to going out on a Sunday evening, used to planning your holiday weekends for the beach, and I could go on, and those are now stopped or restricted, and restricted in a way that did not offer much of a transition, put it that way. And culture is hard to change. So we fully appreciate in public health the concerns that have been raised, and we see signs of that fatigue. That's the reason why we have the mental health response, because people are lonely, there's depression, there are those who are accustomed to doing things or being assisted and not getting that type of assistance. It has really changed the way life is as we know it, and that comes with consequences. I classify it as the side effects of the COVID measures. There are side effects, and side effects that come with very negative consequences. So we have tried in public health, supported of course by the Prime Minister and the Cabinet, to widen the conversation in the last number of months as we move to the community transmission phase, to engage as many more persons as possible, to help with coping mechanisms to dealing with some of these obvious signs of fatigue and frustration. So the mental health response has a very large volunteerism component, because health team alone can't do it. Training people to go out in the community, to visit with the aged, to have conversations, to listen, to provide follow-up support, to help them with their supermarket shopping. We have engaged young people, and we started that on Thursday or Friday this week with a forum of young leaders to provide them with a similar set of motivations to use their platform for youth leadership to do the same thing. And this is a process that's going to have to continue in order to get an all of society approach, because one group alone won't be able to do it. What we hope for in all of this is that the populace will appreciate and understand why we have to do what we have to do, and they will in turn determine what their role is, either in coping or in helping others. And I think that's the only solution. And there may be a glimmer of hope in this, or motivation, maybe not, but the truth is not Jamaica alone. The world is going through this. This is not something that we have imposed as a country and as a government or as a ministry on Jamaicans unnecessarily. This is something that the world is experiencing, and the side effects are universal. And we're really trying our very best to do what is necessary and what we can do to try and overcome that. So we do ask Jamaicans for patience and to place in context why these measures are in place and what it means for them in terms of today, and indeed in terms of the new normal that will be tomorrow and the years to come. It's a teaching moment that we all have to learn from. And we don't necessarily always like to go to class, right? But thank you very much for that question. All right, so I'm going to close by just saying that we are very concerned about the recent outbreak at the Golden Age home. We are, however, confident that between the two ministries, we have in place an approach, a set of protocols to deal with this eventuality. We are happy that no one is critically ill. I mean, we have one person, the initial case. Others so far are asymptomatic. We would like to keep it that way until they recover. But we must always bear in mind that with the vulnerable communities, there's always the possibility of things getting worse. That's the short history of the virus. Persons who are most affected are persons over a certain age with comorbidities. And that is a big part of the concern that we have, which is why we have been saying from the start, we all have to ensure that we observe these protocols in these institutions, because the likelihood of significant and severe outcome are real. And so we're taking it very seriously. We're going to be in there. We're going to do what we have to do. And I believe we will find a way to overcome and to improve the process. Minister Mackenzie, I don't know if you want to add any very final word, and we just close off after that.
Just to say, Minister, that again, the collective response of both local government and the Ministry of Health is critical. We rely on the expertise of the Ministry of Health. Some of the new measures that we are going to be putting in and the improved measures, we will work with you to ensure that those measures meet the requirement. I just want to make a general appeal to the public. We are going to be tightening even more the restrictions and visits and, to the staffing population across the entire infirmaries across the country. There is no place of complacency now based on what is happening. And we are not going to treat Vineyard Town in isolation. We are going to look at the general population of the infirmaries across the country and seek to ensure that we minimize as best as possible any further outbreaks in any of the 15 such institutions that falls under the Ministry of Local Government and Rural Development.
Thank you very much, Minister Mackenzie, and thank you to your team for being prompt in your response, and we appreciate the collaboration, working together for this cause. Thanks to the media that are online and have been listening in and asking questions and carrying the message. Thanks also to the region. I see the regional director online, Ms. Golding. I know there's a team here, the permanent secretary or epidemiologist, Dr. Webster Carr, Ms. Louis Graham of our standards agency, and others who have been a critical support to this process. We continue to push on, fight on, work on, and just continue to encourage the public to be a part of the solution. Let's work together to overcome this COVID challenge, and I think we'll be stronger for it. Thank you very much. Have a good day.
Thanks.
COVID-19 is still here. Always wear your mask correctly while in public places, covering your nose and mouth